Hi, everyone. Thanks for joining us for this webinar. Today, we'll explore lessons learned from a gender transformative program implemented by faith-based organizations in Bangladesh. We'll get started in a few minutes, but feel free to introduce yourself in the chat box. Tell us where you're from. Hello, Esther. Hi, Karen, Linda. Hello, Kasapo, Milton. So we're gonna wait a couple of more minutes while people join. Continue to introduce yourself, please. Okay, so good morning, good afternoon, and good evening, everyone, and welcome to today's webinar on improving health and gender equality among very young adolescents. You will see a slide with instructions in French and Bengali to join the language interpretation channels. If you look at the bottom of your screen, there is an interpretation button to select French or Bengali as needed. Hi, my name is Liza Talukdar, and I'm the Project Management Specialist at USAID Bangladesh and the Social Behavior Change Point Person for the Mission Health Team. And it is truly my honor to be here today. So today's webinar is convened by Christian Connections for International Health, or CCIH, in its role as the faith engagement partner on USAID's Momentum Country and Global Leadership. As you may know, Momentum is a 5-year program aimed at increasing the capacity of partner institutions and local organizations so that they are able to deliver quality, evidence-based maternal, newborn, and child health services, voluntary family planning, and reproductive health care in USAID partner countries. We will hear briefly from each of our speakers, and we have 3 speakers today. And as we go along, I'm sure you will have questions for them. Please use the Q&A box on Zoom to type in your questions, and the team will answer them. And if your question is for a specific presenter, please indicate that along the question. This webinar is being recorded and will be posted on the CCIH YouTube channel and also on the CCIH website at ccih.org under events and webinar recordings. You will also get an email with the link for the recording after it's posted. So before we start, let me just say what gender equality and women's empowerment means for USAID. Gender equity and equality, as well as women's and girls' empowerment, are at the core of our development program. USAID's vision is of a prosperous and peaceful world in which women and girls, men and boys, and gender diverse individuals enjoy equal rights and agency, have equitable access to quality education and healthcare, accumulate and control their own assets, exercise their own voice, and live free free from restrictive. Bangladesh, we're working closely with a wide range of key actors, including the host government, civil society, the donor community, the private sector, and the local organizations, to ensure that the distinct and intersectional needs that women and girls, men and boys have in all their diversities are addressed meaningfully to foster the sustainability of results. We have much to learn today, so without further ado, let's start with our first presenter who will give us some background on this project. As you can see on the screen, Meroji Shabani is an adolescent sexual and reproductive health advisor at Save the Children, United States. With 8 years of experience in adolescent and youth sexual and reproductive health, positive youth development, and gender programming for adolescents, Meroji provides technical assistance and capacity strengthening for quality programming, including facilitating program design and implementation of age and life stage tailored gender transformative and social and behavior change programs. She also supports ASRH programs in several countries across sub-Saharan Africa and Asia. Meroji, over to you, please.
Thanks so much, Lisa, and welcome everyone. Hello. As Lisa just mentioned, the program we're presenting on today was implemented under the Momentum Country and Global Leadership Project. And more specifically in Bangladesh, the Momentum Project partnered with faith-based organizations to strengthen their capacity to design and implement gender transformative programming for very young adolescents between the ages of 10 and 14 years and their families. So there are a few reasons why the project chose to implement the activity. Firstly, it aligns with the project's mandate and USAID's youth policy. Also importantly, a key reason for this activity was to strengthen country leadership and capacity in age and life stage tailored adolescent health and gender programming. So thereby pushing us beyond a one-size-fits-all approach as we move to localize adolescent health programming. We also aimed to generate evidence on how to implement age and life stage tailored programming. So pushing beyond the what and fostering a culture of ongoing learning and adaptation in adolescent health and gender programming. Next slide, please. Next slide. So before describing the activity, I think it will be helpful to understand the current situation and realities for very young adolescents in Bangladesh. Firstly, early marriage remains very common in the country, with approximately 22% of girls getting married before turning 15 years old. This in turn leads to early sexual debut and contributes to high rates of adolescent pregnancy. In fact, Bangladesh has one of the highest, or if not the highest, adolescent fertility rates in South Asia. Evidence shows that 1 in 10 girls gives birth before turning 15. Also, social and gender norms are key barriers that heighten adolescent vulnerability, specifically by limiting adolescent girls' knowledge about their reproductive health, about puberty. In turn, this is linked to poor social and health outcomes for adolescent girls and boys. However, despite these unfortunate realities, BYAs have been given very little attention in the country, and there are very few tailored age-appropriate programs targeting this population in Bangladesh. Next slide, please. Over the last decade or so, there has been increased attention on the need to focus and prioritize BYAs in gender and health programming. And that's for a number of reasons. And evidence is clearly showing that early adolescents offers a critical window of time to intervene with VYAs to improve their health and gender outcomes. Very young adolescence is also considered to be one of the healthiest life stages in a time of significant physical, cognitive, and socio-emotional change. Early adolescence is also a time of social changes and a period of increasingly gendered experience and expectations, where adolescents face pressure to conform to existing restrictive gender norms, and this is particularly more pronounced for adolescent girls. Next slide, please. So it's against this backdrop that the Momentum Country and Global Leadership Project partnered with two faith-based organizations in Bangladesh, Lamb Hospital and World Renew Bangladesh. And the goal of this was to strengthen their capacity in designing and implementing very young adolescent health and gender programming, and also to strengthen their overall organizational capacity and performance. So the goal was to build a model for how faith-based organizations and other community-based organizations in Bangladesh can implement similar VYA-targeted programming and contribute to advancing the implementation of the National Adolescent Health Strategy. So again, to repeat, there are two key components of this activity. The first one being to strengthen the faith-based organizations' capacity to implement an evidence-based gender transformative package for very young adolescents, their families, and communities. And the second piece of that being to develop the organization's capacity through the process of assessment and capacity action plan implementation, which my colleague will describe a bit more in detail later on in the presentation. Next slide, please. So following a series of discussions and workshops with the faith-based organizations, both partners chose to adapt and apply Save the Children's evidence-based Choices, Voices, Promises intervention package. And this program uses a socio-ecological approach to engage very young adolescents, parents, and community members to help improve gender equity and adolescent health outcomes by catalyzing change, recognizing that behaviors and norms are influenced by a myriad of factors at the individual level as well as at the community level. This program was first implemented and evaluated many years ago in Nepal and has since been adapted and implemented in several countries. However, this is the first time the full package was adapted and implemented in Bangladesh. So to describe the intervention in a bit more detail, the package consists of three distinct interventions or components. The first one is Choices, and this program targets very young adolescents for attitude and behavior change related to gender norms. It uses a curriculum of age and developmentally appropriate activities, which are designed to be participatory and to stimulate discussion and reflection between VYA girls and boys, with the goal of helping them to challenge restrictive norms and to promote healthy behaviors. The second intervention, which is the Voices program, challenges existing beliefs and attitudes held by parents on restrictive gender roles while fostering intergenerational dialogue at the household level. So in this program, parents listen to audio testimonials or recorded stories from other parents or community members who've adopted positive behaviors that support gender equality within their homes. So parents listen to these testimonials and are encouraged to take part in a small group discussion, debate on these matters, and really encouraged to practice the behaviors they've heard within their homes. And also in some sessions, the intervention includes activities which help parents to build skills such as being able to communicate better with their daughters and sons about gender and to practice some of the behaviors that they've heard in the stories shared by other parents. And then the third intervention, which is the Promises approach, involves displaying a series of 6 large posters within the community, which are unveiled sequentially, typically on a bi-weekly basis. And the posters include behavior change messages that are placed on large community boards in strategic locations within the community to ensure that many members of the community are able to see it. And the posters include messages which are meant to stimulate dialogue within the community around shifting harmful norms. And at each unveiling session of the posters, a small group of key community influencers are invited, and they engage in discussion about the poster and then are asked to discuss the messages included in the poster within their social network to help diffuse the messages. Next slide, please. So both partners implemented the program in different regions in Bangladesh. Lamb Hospital implemented the program in the north of the country in Dinajpur district, while World Renew works in the southern region of the country, so in Satkhira district. Implementation of the adapted program started in June 2021 and went through May 2022. There was a period in which program activities had to stop due to the nationwide COVID lockdown, but this was how long the program went for. So I will stop here and turn it back to you, Lisa, to introduce our next speakers and the next portion of the presentation. Thank you.
Thanks, Maroji, for providing the setting of this activity. We'll now introduce our next speakers, Dr. Bapun Mankin, representing Lamb Hospital, and Shagota Chishim, who is representing World Renew Bangladesh. Dr. Bapun Mankin currently serves as the director of the Community Health and Development Program at World Mission Prayer Leagues, also known as the Lamb Hospital. And he has been leading development projects under the Lamb Community Health Program, covering MSCH, Adolescent Program, waste management, and disaster risk reduction in the northern parts of the country. In his 16 years of development journey, he was mostly involved in health, education, livelihood, integrated nutrition, and disaster risk reduction, where youth were an important part. And our third speaker today, Shagota Chishim, is a capacity development manager for World Renew Bangladesh. She works with local partner organizations, local communities, and churches in programming that promote peace building and justice, trauma healing, as well as overall improving gender transformative practices in projects. Shagota was a co-manager of the Gender Transformative Very Young Adolescent program conducted with Momentum. In this role, she trained and supervised local staff and provided technical support to the local partner in implementation. Bapun and Shagota will share their organizational capacity building, their program reach, and implementation learning with us today. Please remember to post your questions in the Q&A box along the way so we can discuss those after the presentation concludes. Now, over to you, Bapun and Shagota.
Thank you, Lisa. Now, organizational capacity building of World Renew and Lamb for implementing gender transformative approach. World Renew and Lamb went through a capacity development process named ITOCA. So what's the ITOCA? ITOCA is both a tool and a facilitated process designed for organizational staff to self-score and collaboration to identify strengths, weakness, and capacity development needs, plan support needed by the partner by developing change action plans, monitor changes in organizational capacity through the implementation of plans and reassessment. PEC supported both organizations to conduct ITOCA and OPI assessment. PEC conducted baseline assessment prior to start of program implementation and will conduct end-line assessment. The purpose is to assess organizational capacity changes across predefined capacity area. This contributes to our learning questions on organizational capacity strengthening, key informant interviews. Next slide, please. LAMP and World Renew prioritize their capacity areas. After prioritization of capacity areas, both organizations did completion of 5-year strategic planning, development and finalization of monitoring and evaluation plan, tools and templates, finalization of resource mobilization strategy, development of gender-based violence manual, and adapting for Bangladesh context. Next slide, please. Risk of participation in choice, voice, promises. Next slide, please. In the project lifetime, choices reach over 300 girls and boys across both intervention sites where attendance rates were very high. More women attended voices sessions and influential community leaders attended the promises sessions. Next slide, please. In this slide, you can see some photos of community celebrations, which were the concluding events of this program. It created space for the very young adolescents, their parents, and community key leaders to come together and celebrate the changes. In these photos, the parents are marking their pledges to prioritize their children's health and education, mother and teachers sharing about their positive experiences. Very young adolescents staged drama with reflection equitable environment in their community. It was very exciting event celebrating the changes with hundreds of people. Next slide, please. Now, implementation learning questions. Main learning question, what lessons can be learned from the process of strengthening LAMP and World Renew's technical and organizational capacity to implement gender transformative interventions for very young adolescents in Bangladesh? Sub areas of interest are, how was the choices, voices, promises approach implemented and adapted? What's the unique role of abuse in supporting and implementing very young adolescent health interventions? How did the capacity development support benefits of abuse and the implementation of gender transformative approaches for the adolescents? Next slide, please. We used monitoring data and qualitative adaptive learning methodologies to gather implementation experiences, challenges, and insights, and to answer the key learning questions. Especially, we used a tailored implementation mapping tool, which is called IMT, to guide monthly reflective decisions and record changes made and challenges. To structure post and reflect approaches, we held lesson learned meetings on a quarterly basis to reflect on factors and after review meeting upon conclusion of the implementations. Key informants interviews with community and faith leaders, local government authorities, staff from other local FPUs and NGOs. I took an OPI assessments, pre and post interventions to assess organizational capacity changes and measure improvements in the technical and organizational capacity. Now I would like to request Shagota to continue the next slides. Thank you.
Thank you, Bapun. Good morning and good evening, everyone. Next, we will present selected learning from this program. Next slide, please. This is one of the learning questions of this program. How was choices, voices, and promises approach implemented and adapted? We will now present some selected learning based on this question. Next slide, please. This slide presents some selected learning from choices intervention. Both mixed and sex-segregated approaches were used in choices, and both approaches worked well. LAMB used sex-segregated approach as it was more contextually appropriate for them to hold separate sessions for boys and girls. Adolescent facilitators reported that it enabled very young adolescents' participation and easier facilitation. World Renew implemented choices with girls and boys together. Mixed groups enabled deeper understanding of gender privileges and helped to promote positive changes in very young adolescents' gender-related beliefs and attitudes. Choices sessions blended theory with praxis, which provided very young adolescents opportunities to learn how to treat each other equally and learn from one another. Boys learned that they could use their power and privilege to support and advocate for their sisters. Choices lessons were facilitated by the older adolescents, and very young adolescents could relate to them well. World Renew used mixed pairs of adolescent facilitators to help make the very young adolescents feel at ease. Both World Renew and LAM provided in-depth training on the choices curriculum and supported facilitators throughout implementation. Next slide, please. This slide presents learning from voices intervention. Audio testimonials were liked and stories shared resonated with the program participants. The testimonials inspired program participants to make changes and implement the positive gender behaviors the parents discussed. Parents expressed support for less traditional, more gender equitable roles and responsibilities in their family. And engaging very young adolescents through choices, intervention, and parents through voices simultaneously was important. The programs fostered engagement and facilitated sharing of gender information covered in the sessions and learning between adolescents and their parents. Voices sessions included some participatory parents activities. Parents reported enjoying and benefiting from the activities. The activities opened up new ways of communication and contributed to improving parents' ability to discuss gender-related matters with their children. It also strengthened parental support for very young adolescents' participation in choices as parents learned more about the topics discussed in choices. The take-home materials, which were the story cards, enabled parents to share the behaviors discussed in the sessions with family members, neighbors, and others in the community. We also used testimonies from the intervention that inspired parents to transform their gender behaviors and attitudes. These testimonies were pre-recorded with community members. Next slide, please. This slide presents selected learning from Promises intervention. The posters were liked and moved to other places in the communities, such as in schools, government spaces, to ensure the messages were seen more widely. The visuals and messages sparked a lot of interest and curiosity within the community. Community members were able to engage in dialogue with other influential key community members, including religious leaders, social workers, and government officials during the Promises poster unveiling sessions. The community members have strong ties within the community, which was key to disseminating messages. Local government support was also a key in the success of the Promises intervention. The Union Council Chairman's Office gave World Renew permission to use their courtyard for the poster unveiling and discussion sessions. The courtyard was an ideal location to conduct the sessions because it is frequented by community members, thus enabling greater exposure to the posters and diffusion. Implementation team noted that parents, community members, and leaders placed their commitment to promote well-being of their children and ensure very young adolescents complete their education before marriage. Next slide, please. Here are some of the key adaptations that we made through implementation learning. One of the challenges was age dynamics among very young adolescents, which contributed to varied level of participation. Older adolescents tended to dominate discussions and participate more than younger, very young adolescents. In response to this challenge, implementation teams worked with adult volunteers and adolescent facilitators to improve engagement of younger varying adolescents, encouraging them to speak up and share opinions during sessions. Limited knowledge on gender programming of the older adolescents who served as the choices facilitators was also a challenge. Gender concepts got more complex for them as the choices sessions progressed. In response to these, implementation teams provided additional support to adolescent facilitators to improve their understanding, address any biases, and increase their skills and comfort with facilitating discussions around complex gender concepts. It was also challenging to get the fathers to attend the sessions because the intervention coincided with the harvesting season. As an adaptation, implementation teams adjusted the timing of the group discussion to facilitate male attendance by rescheduling in the afternoon or in the evening. However, challenges persisted. LAMP implemented voices with sex-segregated and mixed groups. In the mixed groups, women rarely contributed to the discussions because they did not feel comfortable sharing their views in front of other men or of their partners. Facilitators encouraged women to speak up and share their views. However, women's engagement remained limited. Poor facilitation skill of the community facilitators was also a challenge. The Union Council member who was initially selected to facilitate World Renew's Promises sessions was not equipped and did not feel comfortable leading the group discussion with high-level government officials. So World Renew replaced the Union Council member with a teacher. After the first session, the teacher received a training and co-facilitated the group sessions with World Renew's project coordinator. Next slide, please. This is another learning questions of this program. What is the unique role of faith-based organizations in implementing very young adolescents' health and gender intervention? Now we will present selected learning based on this question. Next slide, please. So here are some of our learning from faith-based perspectives. World Renew and LAM are properly equipped to implement community-based programming. Both World Renew and LAM drew from experiences working with adolescent groups to adapt and implement the program. Both organizations are well positioned to reach a range of diverse, influential community members and stakeholders to instill and reinforce healthy and equitable practices. Both these organizations are trusted and have long-standing relationships in the community and with government entities, which created a supportive environment and consistent backing of program activities. These organizations also leveraged their deep connections within the community to identify program participants and inform implementation decisions. In addition, World Renew and LAM used their peer faith networks to obtain approval for community level activities and mobilize support to promote very young adolescents' sexual and reproductive health and gender equality. World Renew and LAM also place a strong emphasis on leadership building and mentorship. Next slide, please. Another learning question was, how did the capacity development support benefit the faith-based organizations and the implementation of gender transformative approaches for adolescents? Next slide, please. Tailored organizational capacity strengthening through ITOCA supported World Renew and LAM to implement the gender transformative very young adolescent approach. Trainings, coaching, and material support through ITOCA helped both organizations gain capacity and confidence to implement gender transformative approaches. Strengthening organizational processes and systems built organizational staff capacity, which translated to stronger implementation of choices, voices, and promises approach in communities. Developing 5-year strategic and operations plans ensure that gender transformative approaches will remain a priority and continue to be strengthened. Both World Renew and LAM are planning to build on successes and integrate the choices, voices, and promises approach within their programming. Implementation learning activities used throughout the program facilitated ongoing reflection and analysis of information, contributing to strengthening World Renew and LAM's capacity to apply and generate learning across their work. Now I would like to hand over to my colleague Meroji Sebani to present the concluding slides.
Thank you, Shagota. Next slide, please. So to wrap up, we just wanted to leave you with a few reflections and some key takeaways from our experience applying the Choices, Voices, Promises approach in Bangladesh. Firstly, we saw that gender transformative approaches that foster change across all levels of the socio-ecological model were really key to create a supportive environment for change and also to reinforce the intervention topics and goals that were covered in each of the three interventions. The activity also provides a key lesson around the need to continue to increase the capacity of local partners, including faith-based organizations, to design, adapt, and implement BYA-focused programs that engage families as well as community members. So strengthening FBOs and other local partners' technical and organizational capacity, and then connecting them with systems, we see it as being the way forward within the context of localization. We also would like to acknowledge that capacity development really takes time and requires dedicated funding from donors, especially for complex approaches which aim to shift deeply rooted social and gender norms. So a longer implementation period and time is needed to see real impact. Also, we saw that using the adaptive management approach has really helped us to foster a culture of learning within the organization, and also to gather feedback in real time and make changes during the implementation period. And then finally, it's important to look at how we can embed similar approaches like Choices, Voices, Promises in community systems through engaging local partners, but also in other sectors, including health, education, and other government systems to ensure or to facilitate sustainability and scalability of similar programming. So I'll stop here and turn it back to you, Lisa.
Thank you to all the speakers for your excellent presentation and also for sharing all the lessons of the great work that you have done. So we are now open up to questions. I see we have already received some questions from our audience members. Please continue to put your questions in the Zoom Q&A box, and the team will try to answer them as best as we can. Okay, so for our first question, it's from Dawood Alum, and he's asking if the speakers can also describe the coverage. What was the coverage for the entire intended audience? He has another question, so I'm gonna tag that along with the first one. So could you please also highlight which norm is easy to influence? So over to you, Bapun, Shagota, and Meroji, whether you can take, any of you can take this question for him.
Maybe I can invite our World Renew and LAM colleagues to talk about the reach of the program and the audience.
Yes, in terms of coverage, this program actually covered or reached to, first of all, at the individual level, to the very young adolescents, who are the 10 to 14 years old, and also their parents. All the parents whose children were in Choices, all the parents were covered through the Voices which the voices intervention, which was for the parents. And also in the third layer, we did the promises intervention, which covered the key influential community leaders. So the key influential community leaders includes religious leader, local government authorities, school teachers, social workers, um, and other women leaders, health staff, all those key community influencers. So this program actually covered the all three levels: individual level, family level, and the community level. Yeah.
Yeah, if we think the geographical area, then in our Bangladesh, we call it sub-district. That's mean two sub-districts in different districts. And we cover 4 unions through 2 organizations.
So a second part of his question was, which norm was easy to influence based on your experience? Would anyone like to share on that question?
Actually, we had a specific, we used the curriculums for choices. We used specific curriculums, which had specific themes. And also for voices, the voices also focused on 6 specific behaviors. So the 6 specific behaviors for voices were gender equitable division of household tasks, and also equal homework time for both daughter and sons, equal food for both boys and girls, and encouraging daughters as well as sons to attend school, commitment to not discuss daughters' marriage, and equally bring hopes to girls and boys. These were the 6 specific behaviors that focused through the voices intervention, and parents listened to audio testimonials of the parents who are already practicing these behaviors, these norms, and then they had a discussion around these behaviors and norms, and the parents actually find these behaviors, these norms appropriate for them. These were actually, I mean, the parents shared with us that they have learned about gender program, gender, they need to treat their girls and boys equally, but this program, that this specific behavior, this specific these behaviors actually help them to identify where is the gaps in their households, where they need to bring changes, or I mean, what are the actions, small, still very effective action they can take to treat their daughters and sons equally. So these were the specific behaviors the voices actually from intervention focused, and parents were really influenced by these norms, by these behaviors, and they applied this learning in their family level, in their with their children. Yeah. Bapon might want to add more, or Meruji might want to add more.
Yeah, and just thank you, Shagota. Just to add to that, I think it's not easy to shift norms, but we did see that, Bangladesh does provide a very fertile ground now to see some changes in behavior that are supportive of positive gender behaviors and positive attitudes within families. So we did see through this program that parents were more willing to change their more traditional views on how they treat their daughters and sons, things around allowing daughters to attend school, not mentioning marriage until daughters completed school. So we did see a positive change in that area, but I wouldn't say we shifted any norms. Like we mentioned throughout the presentation, that takes time and more intense programming, but we are seeing, we did see through this program that this willingness to change attitudes and behaviors.
Okay, so moving to the next question. If you were to go, if you were going to recommend implementing this to another organizations, what would you say was the hardest part about implementing this method, and what was the most rewarding part of implementing this program? So what was the hardest part and what was the most rewarding one?
To start with the hardest part, actually we didn't face that much difficulties because we implemented this program in the areas where we already have been implementing other programs. So we had a good relationship with at the community level and also with the government. There was that because of that we did not have much difficulties engaging with the communities and with the government, and we had a good support from the community level as well as from the government, which actually enabled us to implement this program smoothly. But still, I would say that this program, Choices versus Promises, was new for us, for World Renew. It was actually for us to learn about this program with the support of MCGL, Save the Children, and CCIH. So we did not have any clear understanding of how to do it, how to implement it. Especially, there were lots of steps. Um, Choices was easier for us because Choices we had adolescent programs and we used peer educators, adolescent educators. So it was easy for us to implement the Choices with the very young adolescents. But for the voices, we needed to record the audio testimonials, parents' testimonials, and also for the promises, using the posters, using the appropriate messages and images, contextualizing those from the Nepal context to Bangladesh context. Those were a bit, for us, it was a learning process. We learned a lot. And we adapted this intervention or this mechanism to our context. So it was for us a learning by doing, with the constant support, guidance from MCGL and Save the Children and CCIH. And rewarding was actually lots of rewarding. To see how the very young adolescents, they enjoyed the Choices lessons. They enjoyed the activities, the lessons, and the feedback we received from them, that how they are applying this at their families. These were rewarding, and also to see the community leaders, how they are how they engaged with the program. It was kind of a movement at the individual level, family level, and community level, engaging all of them together. So to see these things, to promote the girls and boys education and health at the community, in all level of the community, I think it was rewarding for us.
Okay. Lam, want to add anything to it?
Yeah. And yeah, another thing actually we experienced during our program implementation, that was the changing male and female together. And you may find during our presentation and in the mixed group, it was very tough to make speak out the women when they were joining together in one session. Since we need to change together, that's mean both uh, gender will be transformed. That's mean male engagement and others. Because so we found when we were using the testimonial, that testimonial actually collected from their real life, they were realizing about their life, especially the women. So actually, it was a little difficult to change women and men together, and that's mean the engagement of male. If we can conduct easily, or we can make it easy in the community together for men and women, it will be actually very helpful for community. Even it may bring more impact.
Okay, thank you. So moving on to the next question. Were the training materials and posters translated into many of the languages spoken in Bangladesh, or just the majority language?
Yeah, the materials were translated into the majority language, the Bangla, because our audiences, our community people were Bengali people, and all of them understood Bangla well. So we translate the materials into Bangla, and we just made the language a bit easier, understandable for the community people. Yes.
Okay, thank you. Okay. So, how do you select parents to be engaged in supporting very young adolescents?
So it was actually easy to select the parents because we prioritize the parents whose children are in choices, because we wanted that both parents and children are parents to be engaged in the intervention. So I mean, but we had a lots of popularity of the program, so more parents were interested to join the voices intervention, but we needed to make it a strict kind of a policy that only the parents whose children are choices can join the voices. So selecting the parents was, we had a criteria that parents of the choices, very young adolescent girls and boys, will participate in voices.
Lamp, you want to add anything to it?
Actually, we use the same approach for both program area for the females. And another important was since we need to change the adolescents and their families, that's why it was related to the choices sessions, adolescent and their parents. Yeah, even we had learning that when we went in different meetings or other things, then we found that both their children and also their parents are becoming changed.
Okay, all right, thank you. So the next question is about, could you kindly elaborate more on the selection of group leaders? Were young people recruited to lead the groups? Also, did you experience backlash or resistance from community members? And if so, how was this mitigated?
Regarding selecting the younger people, actually for choices intervention with the varying adolescents, the leaders or the facilitators were the older adolescents. So the older adolescents age range was from 16 to 17, 16, 17, yeah, those age. So young people were engaged, and from our experience, we learned that the very adolescents um, were able to relate well with them, and they were kind of a peer support. The older adolescents worked as a peer support for the younger adolescents, because they were also from the same socioeconomic status, and also they had the same experience, social from different kinds of challenges. They also experienced the social challenges and difficulties, which I mean, they could share with the varying adolescents and support the varying adolescents when they also had the same kind of challenges. So younger people were involved in the program. And another question was whether we have experienced any backlash from the community.
Backlash or any resistance from the community as you were recruiting younger elderly adolescents for as the group leaders?
Yeah, in terms of recruiting younger people as the leaders, no, we didn't face any backlashes, because we already had this practice using the peer educator for the adolescent people, younger adolescent people. And overall for the program, we actually didn't face any backlash from the community people, but we really experienced huge support from the community as well as from the government, local government. Community people accepted the program well. They find this program useful and beneficial for them.
Okay, thank you. So what are the ideas for a unique APO contribution to improving mothers and fathers communication, since the parents seem to have more difficulties with mixed group compared to VIS? So I guess some of the aspects to the question was already answered, but if any speaker can elaborate a little more on that.
In terms of mixed group, yes. In World Renew's adolescent program, we normally use separate groups for boys and girls. But for this program, we were suggested that how about we try bringing boys and girls together, and World really pushed on this idea, and we tried to do it. So but our audience are very young adolescents, so parents are concerned about their safety and security. So what we did is we formed the groups in close proximity, where the people already know each other, and there were their friends and cousins, and also we had adult volunteers present in the discussions, in the sessions, our coordinators. So adolescents were not alone there, but older adult people were there. Also parents, if they want, they could watch what is happening, what they are discussing. So it wasn't a problem for us to bring the varying adolescents, boys and girls together. In terms of parents, it wasn't a problem for us to bring the men and women together, because these parents also this is a discussion. So these parents also participate in government meetings with other men. The women attend meetings with men, so they are kind of used to with these kind of discussions. But what we needed to do is for women to participate in a discussion is we make sure that there are women facilitators. So when the women saw that the women facilitators are there, women facilitator is leading the discussion, they felt encouraged and they also participated in discussion. So it was a bit problem, but we were able to bring men and women together, and also the facilitators paid special attention to the women participants so that they can also participate and discuss and share their views.
Okay. So I guess this is going to be our last question for today, as we're running out of time. So the question is, when talking about faith-based partners, is emphasis put on Christian-based or even others, such as Muslim faith-based ones? So anybody would like to take this question? So it's asking whether, when we're talking about faith-based partners, whether the emphasis is only on Christian-based, or it can also be a Muslim-based ones.
So for our experience in Bangladesh, we worked with LAM and World New, who are both Christian faith-based organizations. But I think the important thing here is that both partners had really strong community ties and longstanding relationships within the areas they work in. So yes, it was good to have the faith-based background, specifically as a Christian organization, but I do think the learnings would have been similar had we worked with a Muslim faith-based partner. I think the key here, like I mentioned, was the fact that both partners were well known by community members, well trusted, and really had been working in these areas and had a strong reputation. So they were, deemed as being a very acceptable way or an acceptable partner to be sharing or leading programming around sensitive matters like gender and adolescent health.
Thanks, Maroji. So we are almost at the end of our webinar today. There were some additional questions which we could not take today, but the team will follow up with those via email. Before we close, will any speakers be willing to make a one-sentence closing statement?
Yeah, for us, for World Renew, it has been a rewarding journey. We are thankful to MCGL, USAID, CCIH, and Save the Children for this opportunity to learn this evidence-based gender transformative approach, and we hope to continue to use this approach and tools that we learned with additional communities, and we also believe that this program will sustain at the field also through the very young adolescents, their parents, and community leaders. Thank you.
Yeah, thank you all for this opportunity.
Thank you, Shakoda. So I hope, please go ahead. Okay, so Thanks, Bapon, thanks, Shagota and Meroji. So we hope you found this session thought-provoking and you can use some of the lessons learned and resources to inform your own country programs. Momentum would like to hear your thoughts on the webinar and will be following up to get your opinions on box to tell us one thing you have to say. Then, on behalf of the organizers, I'll conclude this webinar today. Thank you. Bye.